As part of this year's Functional Medicine Symposium, I want to take a little break from the clinical aspect of things and focus on sort of the ethics of practicing this type of medicine. I feel that practitioners need to be completely zeroed in on the true reasons for being a patient advocate and practicing solid functional medicine and integrative medicine. This is not a forum for folks that want to make a quick buck, although there are many involved in it that do so. And they lose sight of the true meaning of what we're trying to do for our patients here. Core values are very important to any business and any practice in medicine. We had set this up very early in our business model, joining Vistage, which helped identify these for us. The first three we came up with, and then the rest of them we actually voted on amongst ourselves. We uphold these, and we expect these to be upheld by our patients as well. Respect amongst our staff, and we expect to be respected by our patients. Integrity as patient advocates, we want to make sure we uphold that one. And dependability, we have our staff and our providers show up on time, and we also expect that from our patients. Lacking attendance to scheduled appointments is reason for dismissal from our practice. Compassion, accountability, and of course transparency are the other three that we added. I also have this sort of mantra about first do no harm. That was from our medical school days, primum non nocere, and I added second, do it right the first time, and third, be kind, it only takes a second. So these are core values that we uphold dear to us at Carolina Holistic Medicine and also at the Priory Health Academy. Edmund Burke is famously known as saying, "Those who don't know history are doomed to repeat it." So we should learn much from our historical past in medicine so that we do not make the same mistakes in the present and the future with our patients. Of course, as humans, we don't have the ability to access our crystal ball and look into the future, so we have to really depend on what was done in the past. Our history in medicine is our only tool to learn from and to make sure we, again, don't make any mistakes or repeat any bad mistakes that we've made in the past. And medical history is full of bad decisions and bad ideas. So we want to be cognizant of those and learn from that and use kind of a logical process so we can prevent that from happening again, if at all possible. Another thing we need to be aware of as practitioners is not to be a sophist, not to be someone who's a braggart or braggadocious about knowing everything. It is impossible to know everything. And in my clinical experience, the more I learn about a subject, the more questions I have. If I learn another 10% over my experiences or fund of knowledge, there's about 80% more that I need to know. So let's not be like General Custer. He was a war hero. Colonel Custer in the Civil War was noted to be a great cavalryman, and he was very arrogant when he went on to fight in the Indian Wars after the Civil War. So in the 1870s, he was asked if he wanted a couple of Gatling guns to help with his campaign against some Native Americans, and he was arrogant enough to say, "No, I'm okay. I know my enemy," and of course, the rest is history. He and his brother died amongst many other soldiers unnecessarily, actually, because of their arrogance. So let's not be arrogant practitioners. And of course, there's nothing more scary when everyone kind of falls in line and listens to one person's opinion. This was evident in the 1930s and 40s with Adolf Hitler and the Nazi Party, how they somehow were able to convince masses of people in Germany to follow them in a course of world domination and also genocide. So we have to remain critics and skeptics We have to use our Cartesian philosophy on questioning everything. I mean, whatever the CDC or the World Health Organization says, whatever the publications in JAMA, New England Journal, Lancet, we have to question them. There may be some bias behind this that may not be readily apparent, but you can't take things on face value, and you cannot just have following what people say that are supposed experts with blind faith. You got to question it. You got to do your research. You got to have doubt when things are presented to you. Here's a perfect example of some black history in medicine, as far as the Dark Ages and some mistakes we've made in medicine. Everything has some black history in it, some horrible atrocities, even religious groups. But in medicine, in the years past, physicians were asked to support advertising and condone the use of cigarette smoke. Now, maybe this was at the verge of when it was first learned that cigarette smoking was bad for our health. But again, some physicians aligned themselves with picking a particular brand of cigarettes that was healthier for you. One of my favorite philosophers and critics in human history is Voltaire. So Voltaire has some wonderful sayings and quotes, and one of them is that the art of medicine consists in amusing the patient while nature cures the disease. That's very thought-provoking and maybe pretty true. So again, we need to not take a position of arrogance when we treat our patients. We need to listen to them, and we need to work with nature to let them heal. In my opinion, a physician or a medical provider, whether a nurse practitioner, a PA, a chiropractor, an acupuncturist, needs to be a healer, a teacher, and a student of the art. This is an art form, and we must study it diligently. We also need to pass on our fund of knowledge to others. And this is a perfect forum where we're doing that. A good physician or provider must always keep learning and learning from his patients, not just from textbooks and journals. A good physician must be a student of history, and so that we cannot repeat the mistakes of the past. And a good physician must be a teacher. We must pass our fund of knowledge on to others, pass on our skills and our art. And I will say that a physician must have integrity. This is a very noble calling, and I am very emotional when it comes to what we do as physicians for our patients. There are very few other occupations where we are allowed to take control of someone else's body to heal them, and so we must operate with extreme integrity. I don't know with regard to other disciplines, but in medicine, at the graduation exercise and the hooding ceremony, when we become medical doctors, we take the Hippocratic Oath. And in my case, when I graduated from medical school in '91, we actually repeated the original oath, not the modified, updated one that eliminated a few things that I cherish, but actually the original Hippocratic Oath. And if you read it, it really holds true today what Hippocrates basically ironed out in that oath. If you want to see a copy of the complete wording, you can find a translation by Michael North on the internet. And this has been provided by the National Library of Medicine, and it was drafted in the year 2002. But, you know, one of my goals was to memorize this, and I've gotten about the first third of it memorized. But that's one of my goals that's on my bucket list, because I uphold this highly, and I refer to it often to refresh my memory about why I am in medicine. In Arabic, and that's my heritage, being Lebanese descent, Hakim means physician. It also means wise man, and it also means teacher. So this term is used interchangeably in the Arabic language. Some luminaries in medicine go back almost 3,000 years BC. Imhotep was a fairly Renaissance man, if you would. He was a master of many trades. He was the chancellor to the king of Egypt. He was the pharaoh's doctor. He was the first in a line of the king of Upper Egypt, administrator of the Great Palace. He even helped design the first step pyramid for one of the pharaohs. He was a high priest, builder, chief carpenter, sculptor, and amongst other things, I'm sure. But he was also one of the first that we have writings of that was a healthcare practitioner. About 200 years AD, we find a Greek physician and philosopher in the Roman Empire, Galen, who again contributed much to the art of medicine in his day. In more modern times, we see Dr. Benjamin Rush, who again is sort of a Renaissance man. He was considered the father of American psychiatry. He was one of the signers of the Declaration of Independence, an American revolutionary. He was also the Surgeon General for the Continental Army under George Washington, and some referred to him as the Pennsylvanian Hippocrates. Another fellow in recent history who we don't normally hear much about is Dr. Christian Bernard. And this fellow was a physician in South Africa. He was a cardiac surgeon who performed the world's first successful human-to-human heart transplant. So I briefly touched on a few practitioners from antiquity and even recent history who made great contributions to medicine. There's no way in an hour lecture I can possibly cover all the luminaries in medicine over the years that have made wonderful contributions to the art of medicine. But I would want to take a few minutes now and talk about three contemporaries, and these are folks from about the same era in our history who fought the system and eventually prevailed. So the first is Dr. Ignaz Semmelweis. Dr. Semmelweis was a Hungarian physician during the Austro-Hungarian Empire days in the mid-1800s. He was an advocate of hand washing with chlorinated lime water to reduce the infection that pregnant women who have just delivered would suffer. That was a severe problem that they had, where most obstetricians were delivering babies without washing hands. Of course, they didn't use gloves back then. And very often they had just come back from the anatomy lab where they were teaching medical students and touching cadavers, and then going and delivering a baby. So there were thousands of women who lost their lives because of fevers that would occur after delivery. And Dr. Semmelweis actually was an advocate. He made a connection, even though the germ theory was still in its infancy, about what could be done to save thousands of lives. And he himself saved thousands and thousands of women. But he was condemned and dismissed and even persecuted for his beliefs. He was eventually committed to an asylum where he was beaten by guards at the asylum and eventually died from those injuries 14 days later. When my wife and I toured Budapest on a vacation in Hungary, we did make a point of stopping at the Semmelweis Museum, which was his old home and clinic. And it was a pretty modest affair. It wasn't very crowded. There were very, very few people there visiting. But it was very important to me to actually make a site visit since I was there. There are statues in the courtyard of his museum of a mother holding a child because he had saved so many expectant mothers, and he was a hero, actually, to pregnant women. So all too often I see issues in medicine and the delivery of healthcare, and this is what kind of prompted me to retire from almost a 20-year career as an emergency room physician, was the fact that things were not being done properly. So if you fail to learn as a provider, or fail to have the desire to learn new things, if you are too arrogant to find fault in the old standards when they are obviously wrong or have been proven wrong, if you are dismissive, and if you poke fun at new innovations, I have a suggestion. It might be best to retire early and move aside and allow those that adhere to a higher standard to take care of patients. Another contemporary of Dr. Semmelweis a few years later was the Brigadier General Dr. William A. Hammond, who was the Surgeon General of the Union Medical Corps during the American Civil War, or war between the states. So in the mid-1860s, this very brilliant doctor came to prominence. During his tenure as the Surgeon General of the Union Forces, he compiled a lot of data and reviewed the use of chamomile and tartar emeric. So chamomile is a mercury-based agent, actually has mercury and antimony in it. And he basically saw that this was doing more damage than good to the Union sick. And about 3 to 4 for every 1 men that served in the service in the Army would have illnesses due to infectious disease, not to battle wounds. So fighting infections was a prominent thing that doctors had to know how to deal with, not just treating bullet wounds and things like that. And he banned this, and because of that, it was so widely used that there was a big uproar about it. There are a lot of surgeons and doctors in the field really did not like what he was doing there because they felt that he was taking away one of their main forms of therapy. And as a consequence, the powers that be, his folks over him, specifically Statford, who was the war director under Lincoln, basically had him removed and court-martialed. So he was later vindicated back in 1879, many years after he was court-martialed, and I believe this was done posthumously. He is actually buried in Arlington National Cemetery. After the war, Dr. Hammond, unscathed by his court-martialing, actually did go back into private practice in medicine. He was a brilliant neurologist and actually discovered some neurological diseases, some of which were he named or were named after him. So don't be afraid to be unconventional. Great doctors do buck the system. Many have been ridiculed, but a lot of times they're vindicated later. And many lost their posts and were even imprisoned. We see it in modern times in the last 2 decades where medical boards have gone after physicians who adhere to a theory of chronic Lyme disease and try to treat patients and have had success. But because it's not considered standard of care, they've been persecuted, and actually many have lost their licenses by state medical boards. This is really something of the past now, but I don't see a lot of people coming to the forefront to apologize for that sort of behavior in persecuting really good doctors trying to do the best for their patients. We tend to herald these forward-thinking physicians, the ones who took the chance, the ones who bucked the system, the nonconformants, as visionaries and heroes. And we rarely speak of the ones who ridiculed or persecuted them. They tend to be forgotten to history. Another luminary in medicine is Dr. Oliver Wendell Holmes Sr. Now, Jr., we may have recollection, was also someone who served on the Supreme Court, but this is the father, and he was a physician first. Upon retiring from medicine, he was also well known as a writer and a poet, but he was also a very big critic of traditional medicine. He didn't take it for face value, and he was always questioning things. And he is quoted as saying, If contemporary medicine was tossed into the sea, it would be all the better for mankind and all the worse for the fishes. Again, this was a very brief talk about just a very, very few luminaries in medicine who made wonderful contributions to medicine, and time does not allow for me to go into any further. But I do want to balance this out with a few rotten apples. So again, in medicine's dark side, its black side, there are some real SOBs in history of medicine that I want to touch on here. Of course, this is sort of an extreme example. Dr. Harry Howard Holmes, actually AKA Dr. Herman Mudgett, was one such fellow. He was one of the first serial killers to be hanged in America. At the hotel he owned, he would experiment with bodies, often letting women he chose to be victims suffocate to death. The bodies were often dissected, stripped to their flesh, and made into skeleton models. He then sold these bodies to medical schools. So this was quite an unsavory character, and again is a pretty harsh example of the bad that medicine has. But this guy obviously was a sociopath and became one of the first prominent serial killers of American history. When it comes to World War II, we think of another German physician of notoriety, but this is a Japanese fellow, Dr. Shihiro Ishii. He was a Japanese doctor during the occupation of China. That was at the onset of World War II. He tested the germs of Chinese POWs as well as on civilians. Ishii took human experimentation into his own hands, and it is said that tens of thousands of people died due to weapon experimentation and exposure to anthrax, cholera, and other biologics that he was experimenting as biological warfare agents. Of course, I don't think there's any American who doesn't know about Dr. Joseph Mengele. Again, he escaped the Nazi war trials and lived out a long life, and apparently died in, I believe, South America somewhere, maybe Brazil. He was a Nazi SS officer and doctor who experimented with prisoners in concentration camps during World War II. He did horrific experiments and murdered innocents in the name of science. In more recent times, there are some fellows that are quite unsavory. Dr. Farid Fatah. He was an oncologist, and he actually gave diagnoses and cancer treatments to patients who did not even have cancer. He was doing this to obviously pad his bank account. He eventually pleaded guilty to 13 counts of Medicare fraud, 1 count of conspiracy to pay and receive kickbacks, and 2 counts of money laundering. But he did administer chemotherapeutic agents in the guise of medical research to patients that did not even have cancer. And who can ever forget this unmistakable grin, this kind of sardonic grin? Martin Shankerl is an unsavory character. He's not a physician, but he does stand at the forefront of leadership in pharmaceutical industry. He was CEO of a couple of pharmaceutical companies. And Shirelli actually increased what he would do. His shtick was he would take over a kind of a failing pharmaceutical company that had maybe a novel or unique drug, and immediately increased the cost of that drug 400 to even 4,000% in some cases. And he was eventually nabbed, not so much for doing that, which was sort of unethical, but for doing some securities fraud. During the COVID-19 of 2020, he actually asked the government to allow him out of prison because he was serving time for his conviction to work on a cure for the SARS-CoV-2 virus. Of course, that was promptly denied.
Another unsavory character is Richard Roberts, PhD. So he was a doctor, PhD, but I believe his father was an MD, and he actually inherited a pharmaceutical company called URL Pharma. And what he did is when he took over, he did a small, inexpensive study that maybe cost about $100,000 to study Mediterranean fever, which is a very rare disorder, using a drug called colchicine. And of course, it had favorable results, and this was then submitted to the FDA, and they got granted some FDA protection for patent protection because this was considered an orphan drug. Very few patients had this disorder worldwide, and because of this, they allowed this pharmaceutical company to set prices. So colchicine, which was used to treat gout, went from 9 cents a pill to about $5 a pill back in 2011. I was actually in the emergency room during that time, and I witnessed a huge influx of people with active flared up gout. And when I was asking, because it just didn't make any sense, why all of a sudden there were all these folks who were coming into the emergency room with full-blown gout of multiple joints. And when I asked, what was going on, what did they do different? They said, well, they ran out of their medication. They couldn't afford it anymore. The new prescription, Colchris, was so expensive for them that they could not continue to use it, and hence it caused flare-ups of their gout. And then it was a burden on the healthcare system. So while people, shareholders, profited in the URL Pharma, the real victims were the hospital systems that had to contend with the increased number of visits and the patients themselves. Now, I'm sure there are many others who are unsavory characters within the healthcare system, both as clinicians and non-clinicians, but this is just a small sampling of those folks. So again, integrity is very important to me personally, and it should be to anyone who practices the art of medicine, whether as a physician or a nurse practitioner or as a PA or other. First, do no harm. Second, do it right the first time. And third, it only takes a second to be nice. So be nice. And in medicine, we have to answer to a very noble cause as healers, and we have to prove to our patients that we are worthy. It is a privilege to take care of people. It shouldn't be the other way around.
Well, I can't close out this talk without discussing Dr. Robert Pearl's new book, Uncaring. At the time of this recording, it's mid-June 2021, and this came hot off the press last month, and I'm reading it, and it's a fantastic book. It's entitled Uncaring, and it is his second book. His first came out a few years before called Mistreated. But Dr. Robert Pearl was the CEO of Kaiser Permanente for almost 20 years. He is a plastic surgeon. He now works with Doctors Without Borders, going to third world countries to correct cleft palate issues with children. So he does a lot of volunteer work and maintains a presence with regards to how Americans can help fix the broken down healthcare system we currently have. This is a great book. He speaks from the heart, and he is brutally honest about the problems that we face in American healthcare and how it actually destroys and kills doctors and patients. So this is kind of required reading for my academy attendees and students, and I would really encourage everyone to pick up a copy. I gave the link down there for Amazon, but it's available from other outlets as well. Great read. It'll open up your mind to what is wrong with our healthcare system and how it affects us as practitioners.
This is another very cute and funny, but true, quote from Voltaire, and I quote, "Physicians pour drugs of which they know little to cure diseases of which they know less, into humans of whom they know nothing. Let's not be one of those practitioners. And to wrap up this presentation, a little parting shot by one of the luminaries and great minds in medicine, Dr. William Osler, who said, and this should be a lesson to all of us on how to understand the people we're taking care of, and I quote, "It is much more important to know what sort of a patient has a disease than what sort of a disease a patient has."